Hello and welcome to Ask Miss Jai Live. I am very excited to be coming to you today to talk about advocating for transgender people as a public health professional and what it means for us to advocate for gender expansive communities. If you are just joining us, go ahead and put a hashtag live in the comments or put a hashtag replay in the comments if you are checking this out on the replay. But I'm really excited to be talking to you all today a little bit about what you can do as an individual to advocate for gender expansive people in your practice and in the work that you do, and what your organization can do as a public health agency in order to share out expertise and advocate for trans and non-binary people without lobbying. So stick around. I'm very excited for the conversation today, and thank you for joining Ask Ms. Jai Live. Welcome back to Ask Miss Jai Live. My name is Miss Jai. I use she, her, and he, him pronouns. I am the host of Ask Miss Jai Live, and I am so excited to be talking to you all today about how you, as a public health professional, can advocate for gender expansive people, for transgender and non-binary people, as a public health professional, and how your organization can also be involved in advocacy and reducing health disparities for our community. So if you are joining me live for this, go ahead and put a hashtag live in the chat. Drop any questions that you have, and I will answer them live on air. If you are catching this as a recording, go ahead and put a hashtag replay. Please feel free to put any questions that you have there. I do check them regularly, or any comments or things that this is bringing up for you. If you are a public health professional and you say, and you're thinking to yourself, this is another way that I can advocate, go ahead and put that in the comments as well, because there's a lot of ways that we can support our communities. So I'm going to jump into, first I have 3 tips for what you can do as an individual working in the field to advocate for gender expansive people. And then I'm going to talk about 3 tips that can be done at the organizational level, and what your organization can do in order to advocate for gender expansive people. So first, I want to talk about advocating for the collection of sexual orientation and gender identity data. When I started working in public health, I was working as an HIV tester, sexual health educator, and was working with LGBTQ youth. And I would sit in on different conversations within the organization, different conversations on our team, and it became very clear to me that unless we were serving predominantly LGBTQ people, or who we perceived as predominantly LGBTQ, that the collection of sexual orientation and gender identity data just wasn't happening, or it wasn't consistent. And that created an issue, because then when we were trying to find out what health disparities looked like in the with the folks that we were serving, the communities that we were serving, we couldn't disaggregate that data or split it apart by sexual orientation and gender identity and show some comparisons. So we couldn't make a comparison of what is the experience of heterosexual people in our services versus lesbian or gay or bisexual people in our services. We couldn't make a comparison between what is the experience of cisgender people who are receiving services versus the experience of trans or non-binary people who are experiencing or receiving services. And so advocating for the collection of sexual orientation and gender identity, not only that it's being collected, but that it's being collected effectively, meaning that staff are trained to know how to collect this information, that your colleagues understand the importance of why we're collecting this information and how it's used for health equity work, can be a way that you can help to advocate for trans and non-binary health equity within your sphere of influence as an individual. And then also making sure that you are taking the time and the energy to collect that sexual orientation and gender identity information, and letting folks know how that information will be utilized, that it will be de-identified, but it allows us to understand kind of what's happening across these communities within the services and within the service area. So that's the first thing that you can do, is you can advocate for the collection of sexual orientation and gender identity demographic information, and the use of that to improve health equity initiatives. The second thing that you can do is you can ask and use names and pronouns correctly. And what I mean by this is that we are asking the folks that we are serving the names that they would like to go by in the services and the pronouns that they use, and not just singling out those we perceive as transgender or non-binary or as gender fluid, and only asking those folks, but standardizing it across the services that we provide as a direct line staff, or if you're a program manager, the programs that you oversee. This is a way that we can ensure that everyone is being called by a name that they feel respected and supported by, and by pronouns that align with their gender identity, as opposed to assuming based on the way that someone is perceived or expresses their gender. This is also helpful. I used to work in a medical case management program, and then I ran a medical case management program, and so we would often do case counseling when we were coming up with challenges for someone's situation or getting someone services that they needed, as a way to work together and sort of come up with some solutions. Uh, in those instances, you might have a colleague who misgenders or uses the wrong name or the wrong pronouns. This is also an opportunity for me to soft correct that, meaning that I might let my colleague know, oh, that's their legal name, they go by this name, or that's their legal gender or legal sex marker. The pronouns that they use are they, them, for example. So it's a way that we can also help our colleagues in creating more equitable environments, and creating safer environments for our trans and non-binary and gender expansive patients and clients. It also, outside of equity, outside of safety, it also helps our colleagues not make the mistake of unintentionally misgendering or misnaming someone. So it also provides the opportunity to avoid some embarrassment, and avoid making a mistake with a client that's being served. So we're also giving the more information to our colleagues who are working with this person around how to support that person. I do think it's important that we are keeping in mind what level of information that we're sharing. So, where it might be appropriate for me to say, oh, they go by this name or they use these pronouns, it may be less appropriate for me in those situations to share medical background. So, like they're undergoing gender affirming hormone therapy, or they've experienced gender affirming surgeries, or X, Y, and Z around their identity, right? So I want to make sure that what I'm sharing with my colleagues is appropriate at the level of engagement that's occurring, and that we are not sharing information that would be considered sensitive as well. So that is a way that you can advocate for the gender expansive people that you are serving. You can also be the advocate voice in the room. When I started my work in public health, I also ended up on a number of coalitions. I was working as part of a statewide advisory group on HIV, hepatitis C, and STI services for the state of Arizona. I was sitting on a number of local city of Tucson, as well as county uh, community advisory boards, essentially, or coalitions. And oftentimes I was either the sole trans person in the room, or I was the first trans person in the room. And so what I found was that it was necessary for me not only to advocate for gender expansive people in those spaces, but to advocate for intersectional identities in those spaces as well. And as a white trans non-binary person, being able to say like this, the trans experience is not a monolith. We need to actually be able to disaggregate information by the experiences amongst our community, that we know that health disparities are greater for Black and Brown trans and non binary siblings compared to white trans and non binary people. So being able to share the expertise that you have, share the knowledge that you have around serving trans and non binary communities, and recognizing that there are some tables that we are not invited to, or there are some tables that we are just not at. And what it can mean for you as the experts to be in the room and say, we're looking over this data for the county. I'm noticing that everything is separated by male and female. Do you have data on the gender identity demographics? Do you have information on the focus groups that were conducted? There was a focus group that was conducted for LGBTQ people. Were trans and non-binary people part of that focus group, or not part of that focus group? Did you have any representation? So these are ways that we can start to advocate at the tables that that you are invited to, these are the ways that you can advocate for trans and non-binary health equity and trans and non-binary people in those spaces. So that is a bit about what you can do as an individual to advocate for trans and non-binary people as a public health professional. If there are other thoughts that you have on what you can do individually to advocate for trans and non-binary people, please add them in the comments. I'd love to hear them. Some things that I think about with advocacy is that there are varying levels of advocacy. For some folks, advocacy is marching. For some folks, advocacy is policy work. For some folks, advocacy is helping to shift behaviors and attitudes and provide skills. So there's lots of ways that advocacy can look. And if you have other ideas on what advocacy can look like in the work that you are doing and what you can commit to, I would love to hear that in the comments. But now I'm going to shift to what your organization can do. Because working in public health, there are a lot of restrictions around the funds that we receive, especially around things like lobbying. A lot of organizations receive governmental funding as part of their programs, and there are stipulations that you cannot lobby based on certain funding streams. And so I think it's important for us to uh, be able to pick apart what this means and what it means for your organization to still be an expert voice in the work that is taking place, and the difference between being an expert voice and actively lobbying. So when I talk about being an expert voice, part of that looks like recognizing like what your role as a public health agency is in the work that is taking place. So, for example, HIV criminalization laws are are becoming a thing of the past, but are still very much present in several states. There's legislation that is present that also shifts the ways that like comprehensive sexual health education can take place in uh, K through 12 education. There's all sorts of legislation that potentially could impact the work that you are doing or intersect with the work that you are doing. So when I was a sexual health educator for an LGBTQ youth group, I there was also a law on the books that made it illegal or to talk about comprehensive sexual health education in a public health, or excuse me, in a public K through 12 school that mentioned any sort of LGBT or really any sort of like gay male sexual contact, and didn't frame it within if that was to occur, the person would ultimately get HIV and ultimately succumb to HIV. So because we know that that was the legislation that was present, we were able as the experts in sexual health education in talking about the importance of tailoring sexual health education so that it is applicable to the types of behaviors and sexual activity that folks are having. We were able to provide expertise around what our recommendations were and how you could navigate that in an environment that was not necessarily supportive without actively lobbying legislators. So, for example, it looked like talking to other grassroots organizations who were doing lobbying efforts and giving them some language so they understood, showing them the data and the research, helping to connect the dots, creating reports on how effective that sexual health education was with LGBTQ communities and LGBTQ young people. So being able to like bring those pieces together can be helpful. And the reason I bring this up for organizations is because we are seeing a lot of anti-trans legislation take place across the country, and we are anticipating that that is going to continue to increase. That we are now seeing, as we saw last week, the oral arguments for supporting a ban on gender affirming care for youth. There's concern around gender affirming care bans for folks of any age, not just people under the age of 18. There's concern around diversity, equity, and inclusion initiatives and the use of that language. There's concern around using language like sexual orientation and gender identity and gender expression. So what we can do as experts in our field is we can share information and we can report on trans and non-binary health equity as it relates to the work that we are doing. So for example, if you are working in environmental health, then you might report on the experiences of green spaces and walkability of a neighborhood and pollution in a neighborhood and food deserts, right? Those might all be part of that environmental health scan or the environmental health work that you do. Part of your report can also include where we are finding LGBTQ people, where we are finding trans and non-binary people. The Movement Advancement Project, for example, has some information on the experiences of trans and non-binary people based on the locations of where they're living and how there's a greater likelihood of being exposed to environmental pollution if you're trans or non-binary compared to our cisgender counterparts. So this is a way that we can start to integrate health equity, trans and non-binary health equity into the reports that we are doing and into the work that we are doing to give a more robust picture around what our expertise is and how this impacts us as individual people. So that's the first thing that you can do. The second thing about reporting on trans and non-binary health equity is you can also ensure that that report then gets back to the people who need it. So, for example, I just sat on a focus group for Denver Department of Public Health. They're doing focus groups for their 5-year community health needs assessment, and the focus groups are focusing on priority populations that are often underserved or have not previously been served. And so one of the first questions that I had while I was sitting on that focus group as a participant was, what are you going to do with this data? How will it be reported? And how will we, as lay people or people in our community, have access to the report? Because when you are the expert in your field and your organization is doing this expert work, you are able to say, you're able to put out this information into the world, but we also want to get that information into the hands of people who can use it. And sometimes the hands of the people who can use it are your constituents, the folks who have given this feedback to you as well, because we are also the folks who are interconnected with other trans and non-binary people, other folks in the priority population, and are able to point to this report and say, hey, look at this report. It's really important that we use what we know now in this community to make some intentional strategic shifts. And it allows us as individual people who are not associated or connected with an organization to be able to advocate and do that lobbying and work with legislators. So it gives us the tools that we need. So you want to both report on trans and non-binary health equity. You also want to ensure that that those reports are getting into our hands. The second thing that you can do as an organization to advocate for trans and non-binary people as a public health agency is that you can collect and provide feedback to your collaborators. So you can collect feedback from the folks that you are serving on what their experience was like connecting with a referral, if there are any collaborators that they have had positive experiences with, collaborators they've had negative experiences with, and then actively work and use that peer relationship with your collaborator to say, hey, we're seeing a trend of folks who are trying to access services and are having challenges with getting placed. So, for example, when I worked at an LGBTQ youth drop-in center, I worked on a multidisciplinary team. There were 5 of us that were from different agencies, and we all had different expertise. There was a licensed clinical therapist, I was the sexual health educator, there was a social worker on staff, there was someone who did housing case management, and there was someone who focused on working with unhoused folks and getting them access to other resources outside of just housing. And so being able to work with those collaborators, I was able to go to a collaborator when there was an issue, for example, with placing in housing. We could say, hey, we've tried to refer a number of trans and non-binary folks to your housing service. When they just go to the service on its own, folks are confused about how they may be eligible for services. There's confusion as to whether or not they can be housed or placed. There's confusion around what shelter services might be available. So can we work together to make this streamline this a little bit, make it the process easier on our gender expansive patients and clients and service members. So working with our collaborator to solve this means that we have to be collecting and then providing that feedback to our collaborators in the spirit of we are all trying to do our best by the communities that we are serving. And I think when we approach it from the perspective of we are trying to do the best by the communities that we are serving, it helps us step outside of what can sometimes be present in public health, which is some protection around the work that we do, some personalization, because oftentimes we are the communities that we serve. And because we personalize it, our personal feelings getting hurt when there's criticism about the work that we are doing, and seeing that criticism for what it is, which is constructive, and trying to come together to provide a better service. So collecting and providing that feedback to collaborators about the experiences trans or non-binary people are having in the service can be incredibly helpful. And then the final thing I'm going to share with you is that as an organization, you also have the ability to not just report on trans and non-binary health equity as part of these larger reports, but also to do deeper dives and create things like white papers and share your expertise on how priority populations are experiencing whatever health condition or social determinant of health you are addressing in your service. So, for example, if you're working in a program that is looking at identifying and treating hepatitis C, then you might write a white paper on um, the number of folks who are cisgender who are able to have access to hepatitis C treatment compared to folks who are trans and non-binary who have access to hepatitis C treatment. Or you might also look at what that looks like in terms of economic ability or economic security within cisgender and within trans and non-binary communities. So you can start to share your expertise and really drill down and focus into these communities in with from an organizational standpoint. The other piece of this is that you are also able to then create the materials and put your organizational weight behind the things that we are then able to use as individuals and as community members and as grassroots organizations to be able to bring to our legislators and say, this white paper just came out from the Department of Public Health, and the Department of Public Health is saying that in terms of vaccine equity, there we're seeing a disparity in the folks who are receiving vaccines when they are heterosexual parents versus lesbian, gay, bisexual parents, right? So we can start to see this. We can start to point directly to where those health disparities exist, and then we can use that as an opportunity to apply pressure and actually shift towards focusing on some of the health disparities that we know are present, but now we have the organizational backing saying like this is actually a disparity that is present. I want to say hi to the folks who've joined on Instagram. I see there's a couple of folks on there and a couple of folks who joined and then popped off, but thank you for joining. So creating these reports, sharing your expertise as an organization, um, and laying that out as like this is just what we are seeing, not even necessarily saying this is the legislation that needs to change, this is the legislation that needs to be enacted, but creating recommendations that are more neutral, creating recommendations that say things like the vaccine equity, for example. A recommendation might be we want to understand more about why there's disparities in between these two population groups or these two priority populations. It might be that we know we already have found the research, we've already done a needs assessment, and we found that some of the challenges are that there are not services that are available in the communities where we live, work, play, rest, and experience our lives, right? And so we might want to shift to developing a program that is going to be in some of those locations. So it gives us an opportunity to take a more uh, really a more unbiased approach and have more substantial and effective data and information to then be able to make the decision and start addressing health disparities. So in a lot of ways, it's avoiding a lot of the political minutia by just being able to focus in on what we know as experts in our work, what our communities are telling us they need, and how we can get services to those communities. Again, coming together across sectors so that we are providing the highest quality service from an evidence based perspective. So, again, that data, that information, knowing that this is what our community is needing and what they're asking for, and then providing a high quality service that meets that need and addresses the gap in service. So I hope that this has been helpful for you in seeing that that advocacy is not a dirty word. We can advocate as public health professionals, and we can advocate for the health needs of minority populations, priority populations, marginalized people, and that is appropriate for us as professionals in this field to be doing that work. There's just some ways that we have to go about it, and we have to think about it, that kind of pulls advocacy away from this idea of lobbying. So I hope that this has been helpful. My name is Miss Jai. I run Ask Miss Jai Live. This is the final season of Ask Miss Jai Live. We have one more episode left. So I hope that you'll check it out next week on Friday at 12 o'clock Mountain Standard Time. After that, if you would like to stay in touch, you can find us on our YouTube channel at Ask Miss Jai. You can find us on Instagram at Ask Miss Jai. You can find me on LinkedIn under Miss Jai, or you can check out our website at www.askmissjai.com. Until our next show and our last show for season 4, I want to thank you for taking your time to spend with me today, especially for the folks who are on their lunch hour right now. And as always, I want to thank you for investing in the health and the well-being of trans and non-binary and intersex communities.